975735-1, Moderna, Arkansas. Acquired COVID-19 on January 10th. Comorbidities and was declining prior to vaccine. Resident expired on January 25th. 975744-1, Pfizer, California, female. Nothing. 975762-1, Moderna. Nine seven five seven six two -1, Moderna, Idaho, female, patient deceased. 975918-1, Moderna, unknown, male, death narrative. 975952-1, Pfizer, unknown, male. 976032-1, Pfizer, California, male. Hypoxic, lethargic, and was sent to emergency department at around 7 a.m. on January 26th. At approximately 11 a.m., emergency physician notified this writer that patient was not going to overcome his illness and would be placed on comfort care. At approximately 11:30, this writer was notified the patient had passed away from multi-organ failure. 976111-1, unknown, Pfizer, male, dosed Saturday morning and died Sunday at 11:50 p.m. 976112-1, Moderna, California, female, resident expired on January 21st. 976146, Moderna, California, female, resident is asymptomatic. 976166-1, Moderna, California, female, asymptomatic. 977320-1, Moderna, Michigan, female. About 20 hours after the vaccination, resident was having a hard time breathing. 911 was called. Resident coded multiple times at the facility after CPR. She was taken to ICU. She coded again and was placed on life support. Due to her choice to not be on life support, she passed on 11/26/21. I think they mean January 26th, 21. 977358-1, Moderna, Florida, male, cough, congestive heart failure, death. 977426-1, Moderna, Georgia, male. She found him in his room at 9 p.m. unresponsive with seizures. Hospice was alerted and recommended oral Valium. He continued to be unresponsive and expired the following day at 7:30 p.m. (977-963-1, Pfizer, Alabama, male. Report per patient's wife. Patient took his usual nap around 12 p.m. She found him lying in bed, unresponsive at 2 p.m. Patient's wife called the funeral home. Okay. 978199-1, Pfizer, Texas, male. Arm hurting, used his oxygen at time of bed, appeared vomited. Oh, okay. 978567-1, Moderna, California, male. Resident received the first dose of Moderna vaccine on January 12th, 21, and tested for COVID-19 on the 12th. Resident tested positive on the 13th. The resident was transferred to acute hospital due to desaturation of oxygen. The resident expired in hospital on January 24th. So now they're doing COVID tests during the time of the vaccine. 978754. Pfizer, Colorado, female. No symptoms immediately after vaccination, although patient passed away around 6 p.m. unexpectedly. Staff talked with her last time at 5:30, then found her at 6 p.m. passed away. Unknown at this time if death is directly related to receiving the vaccine. Gotta think about it, eh? 978872-1, Pfizer, Louisiana, female. 72-year-old female patient received the first dose of BNT 1628 B2 on January 15th. And patient died suddenly on January 21st at 2. 979081-1, Moderna, California. May or may not be connected to vaccination. Instructed to report it from our medical director and director of nursing. Patient found dead in home the next morning after vaccination. 979101-1, Pfizer, Iowa, female, cardiac arrest, no warning signs. 979155-1, Pfizer, Arizona, male, received the vaccine on January 3rd. On January 4th, started having headaches, vomiting, pain in the back of the neck, headaches, chills, and loss of speech. 979223-1, Moderna, California, male, patient developed SOB but reported good oxygen saturation. Instructed on going to ER if worsening symptoms. Patient eventually expired on January 22nd. 979255-1, Pfizer, California, male. Patient received COVID vaccine the morning of January 18th at the Public Health COVID Clinic. Worked for PH. Later that night, while in bed, patient reported difficulty breathing to his wife, then turned blue and became unresponsive. Family report, patient was without any symptoms prior to event. Patient expired at 1:53 a.m. on January 19th. 979533-1, Moderna, Arizona. Vaccine was given on January 19th. She felt poorly on the 20th. She felt dizzy and was not normal. She went to ER on the 24th. She was assessed as not having fractures, respiratory complaints. She was awaiting transfer when her oxygen levels started dropping substantially. She declined aggressive intervention and she died within a few hours. 979796-1, Texas, Moderna, male. Patient went to hospital with COVID symptoms on the 10th and passed away on the 22nd. 979818-1, Pfizer, Texas, male. Was performing yard work on January 26th and became short of breath. CPR was initiated at 17:55. At 19:09, pronounced by ED, dead, cardiac arrest. 979837-1, Pfizer, Nevada, male. The patient was upstairs to change for his doctor appointment on January 25th. And patient was given TPA. Patient continued to be in asystole, and time of death was called 11:35 a.m. So 979841, Moderna, Montana, male. Patient likely presented to vaccine appointment with asymptomatic early infection of COVID-19 as he presented 2 days post-vaccination and tested positive for COVID-19 on rapid and PCR tests. He was hospitalized where he eventually died of complications from COVID-19 while in ICU. Date of death, January 15th. What? 979990-1, Moderna, Ohio, male, sudden cardiac arrest. 980107-1, Pfizer, Alabama, female. Patient noted to have a change in status at 11:23 p.m. that night. Her oxygen saturation had dropped from normal to room air to 82% and required oxygen. She was lethargic, altered mental status, and not responding verbally. She then began to model. Her oxygen saturation worsened to 51%. By the next day, she had expired. January 14th. 981061-1, Moderna, Tennessee, female. Patient died 3 days post-Moderna vaccine. 981225-1, Pfizer, Maryland, female. Inoperable pancreatic cancer, received second Pfizer vaccine approximately 12:30 p.m. on the 27th of January. At approximately 16:30, patient complained of abdominal pain and was given Levsin morphine. At approximately 19:30, patient was found on the floor covered in large amounts of MSS, was unresponsive without a pulse. 981406-1, Moderna, Tennessee, female, stroke, death. 981407-1, Pfizer, Missouri, female, expired in sleep. January 24th. 981849-1, Moderna, Indiana, male, died January 16th. 981912-1, Moderna, California, female, patient presented to the emergency department complaining of chest pain, pale, cool, and hypotensive. The patient was discovered to have a large saddle pulmonary embolism, went into cardiac arrest, and expired. Note, the patient received her second Moderna vaccine on January 23rd, which would place her first one approximately December 25th, if she received them at the appropriate interval. This information is from the patient's daughter, and the ED record, the information is not available in CAIR. Per the daughter, the patient started feeling ill on January 21st and improved on January 25th, then acutely worsened on January 27th, resulting in the ED visit. 981938-1, Moderna, unknown, male. Vaccine administered on the 22nd of January at around 16:21. At 5 a.m. on the 23rd, so that morning, he cold blew and was called as patient found to be unresponsive, breathless, and pulseless. Facial cyanosis noted. Autopsy currently pending. 981945-1, Moderna, unknown, male. Was given the vaccine on January 8th and passed away on the 17th. These events occurred from COVID-19 itself. However, this case is being reported to the FDA since this vaccine is under an emergency use authorization. 982370-1, Moderna, Kentucky, male. Patient died at hospital on January 16th, approximately 48 hours after receiving vaccination. Believed death related to fall at home prior to vaccination. 982472, Moderna, New Jersey, male, worsening respiratory failure, death, January 27th. 982495-1, Moderna, Oklahoma, male. Client's sister called crying and said the family just found out yesterday that client had died sometime last week. The last time any family talked to him was on the 19th of January. Missed calls showed on the phone on the 21st. His last internet search was sternum pain. She will also call the agency and report this. The vaccine isn't in the registry at this time, so I don't know the lot number. But she said he was due back in 1 month. She said he was very healthy and ran triathlons. 982517-1, Moderna, unknown, male. Patient received COVID vaccine on the 11th and passed away on the 25th of January. 982541-1, Moderna, Illinois. 36 hours after vaccination, the patient had increased respiratory distress. He was transferred to the acute care hospital nearby. Doesn't say when he died. 982778-1, Pfizer, California, male. They had a COVID vaccination in their clinic on January 5th. And he was monitored in our observation area under the supervision of an RN post-vaccination for 15 minutes. He did not complain of any side effects and did not appear in any stress. Per daughter, employee went to his pharmacy in the evening sometime after leaving the facility. Daughter reported that he called his wife from the pharmacy and asked his wife to come and pick him up as he was not feeling well. His wife went to the pharmacy and found him in the parking lot where he gave her his medical card and asked her to go get something from the pharmacy. His wife went to pick up the medication and upon her return found him in the car in the passenger seat. The daughter reported that he took the medicine that the wife brought from the pharmacy while in the car. His wife drove him home, and upon reaching home, when she tried to get him out, he was unresponsive. Family called the paramedics and he was pronounced dead. I have informed pharmacy and they are reporting to FDA their protocol. PhD has been notified as well and they are doing their reporting per their procedure. Daughter reported that employee had a history of heart disease and diabetes and a pacemaker. 982826-1, Pfizer, Nevada, male, was at work on the 26th of January and collapsed. No known complaints at the time. CPR was initiated immediately, transported to ER, and pronounced dead. 982890, Moderna, Mississippi, male. Patient presented to ER via EMS at 15:56, 3 days after receiving the vaccine. After TOD, patient was swabbed for COVID-19 and the results were positive. Why are they swabbing for COVID while he's in emergency? 582942, Moderna, Arizona, male. Per recipient spouse, vaccine recipient became ill during the night of January 21st or early morning of the 22nd and was deceased in the morning of the 22nd. 983169-1, Pfizer, Kentucky, male. Client received the COVID vaccine on the 5th of January. He was found unresponsive on the 10th of January. 983173-1, Pfizer, Kentucky, female. Client received the COVID vaccine on the 5th and died on the 24th. 983184-1, Pfizer, Kentucky, female. She was, doesn't say when she was given the vaccine, but she was tested on the 11th, and she was tested for COVID on the 10th, and was negative, and then she was again tested on the 11th and tested positive. And she died on the 15th. 983187, Pfizer, Kentucky, male. Client tested positive for COVID by rapid test on the 8th of January. On the 9th of January, at 2:05 p.m., his oxygen saturation dropped to 86% and oxygen was initiated. A non-productive cough was noted on the 10th. Oxygen increased to 3 liters. January 12th, client became non-responsive with 30-second periods of apnea. Lung sounds were noted with crackles on the 15th. And I guess he died. 983189-1, Pfizer, Kentucky, female. Patient tested positive for COVID by rapid test on January 6th. She began to demonstrate a dry cough on the 11th, and then on the 12th, her oxygen saturation was 79%. On the 19th, she was unresponsive. 983192-1, Pfizer, Kentucky, female. Patient received the COVID vaccine on the 5th of January. Tested positive for COVID rapid testing on the 6th. Demonstrated poor appetite and saturation, and oxygen saturation was initiated on the 12th at 4 liters per nasal cannula for shortness of breath. On the 22nd at 3 a.m., patient was unresponsive and without vital signs. 983193-1, Pfizer, Kentucky, female. Demonstrated a cough on the evening of the 5th of January after receiving the COVID vaccine earlier in the afternoon. A rapid COVID test was performed and was positive. She began to demonstrate shortness of breath with exertion on the 7th and lethargy on the 12th. On the 19th at 4 a.m., patient was unresponsive and without vital signs. Why don't they test them for COVID before the vaccination? I don't understand. Why are they waiting until after? 983482-1, Pfizer, California, male. Per daughter, patient suffered stroke 1 hour after he was given the COVID vaccination. He passed away on January 24th, 2021. 983721, Moderna, unknown, male. Patient with severe dementia and hospice for end-of-life care. 983766, 983766-1, Moderna, North Carolina, female. Out of breath on the 21st, and she passed away on the 24th. 985205-1, Moderna, Ohio, male. Patient was feeling dizzy and under the weather after the vaccination. The following day, he died in his sleep during a nap. And so that's it until next week. So, hopefully there'll be less deaths. So the take from this is, if you're vomiting, go to the hospital. Don't wait, go immediately. Watch out for batch number BNT 162B2. Or don't get the vaccine at all.